Hi! In this video, I will explain what HIPAA is, why healthcare institutions and their partners must comply with it, what value it brings to business, and briefly introduce BALTUM Bureau and our approach to compliance assessment. This video will be useful both for healthcare organizations and for IT companies processing medical data. BALTUM Bureau is a certification body operating in the fields of auditing, certification, and training. We work with international management system standards with a strong focus on information security and confidentiality. In all our work, we adhere to the principles of independence and objectivity, ensuring a professional and impartial approach to certification. BALTUM conducts audits and certification of management systems in accordance with international standards, including HIPAA. We support organizations throughout the entire compliance journey: gap analysis, documentation, implementation, and final audit. We also provide training programs that help professionals practically understand privacy and security requirements. My name is Kyrylo. I work as an auditor and privacy consultant and lead BALTUM Bureau. I have practical experience helping organizations implement HIPAA, prepare documentation, and conduct certification audits. In this video, I explain HIPAA from a practical perspective, focusing on what it means for your organization. HIPAA is a US federal law that establishes standards for protecting sensitive health information, PHI. It consists of two main parts: the privacy rule and the security rule. If you work with patients in the US or provide IT services to American healthcare providers, HIPAA compliance is a legal requirement. HIPAA exists to ensure that patients' medical data is not disclosed without their consent. For business, it is not just a law, but a ticket to the US health tech market. Without HIPAA compliance, you will not be able to sign contracts with any serious healthcare institution, and violations may lead to multi-million-dollar fines from the OCR regulator. It is important to understand, unlike ISO, there is no official government certificate for HIPAA. It is an ongoing compliance process. However, if your company already has ISO 27001, you cover around 70 to 80% of HIPAA security rule requirements. We help organizations build systems where international ISO standards become the foundation for HIPAA legal compliance. HIPAA defines roles. Covered entities, CE, are those who directly provide healthcare services. Business associates, BA, are service companies, such as software developers, that have access to data. The key document is the BAA, Business Associate Agreement, which legally defines responsibility for data security at each stage. Organizations implement HIPAA for several reasons. First, to avoid massive fines that can destroy a startup. Second, it opens doors to corporate contracts in the US. Third, it demonstrates to patients that their privacy is your priority. In today's world, digital security in healthcare is synonymous with trust. HIPAA operational requirements include 4 areas. First, regular technical risk analysis. Second, strict access control. Every database access must be logged. Third, mandatory employee training. And fourth, an incident response plan. You must know how and whom to notify if data has been compromised. The assessment process takes place in 2 stages. Stage 1 is a review of your policies and BAA agreements. We check whether you have a foundation for data protection. Stage 2 is a technical review: encryption, logging, and physical server security. Based on the results, we prepare a letter of attestation, which you can present to partners as proof of an independent audit. From my experience, the most common gaps are working with subcontractors without signed BAAs, storing medical data on unencrypted laptops or in Google Docs, and formal employee training that no one actually completes. The auditor's role is to identify these weaknesses before hackers or regulators do. The business case for HIPAA is clear. Without a compliance report, your sales in the US can take months due to endless security reviews. With a completed audit, you shorten this process by half. For B2B companies, HIPAA investments usually pay off with the first major US contract. If you are considering entering the US market, here is where to start. First, clearly define the types of data you collect. Second, conduct a technical gap analysis to understand your current state. Third, train your team. And fourth, contact us to receive a professional audit and compliance confirmation for your clients. BALTUM Bureau offers specialized HIPAA training. Our course covers not only legal theory, but also practical steps: how to properly draft BAAs, which AWS or Azure cloud configurations are required for compliance, and how to pass security assessments from large clients. The course is available in Ukrainian, English, and other languages. Key message: HIPAA is not just a formality, but a foundation of healthcare security. If your organization works with medical data, HIPAA compliance becomes a business necessity. It is a structured way to prove to clients that you are a reliable partner who takes privacy seriously. Thank you for watching. If you have any questions about HIPAA implementation or certification, visit baltum.io or email info@baltum.io. BALTUM Bureau provides both consulting support for standard implementation and certification services through our accredited partners. We offer a free initial assessment so you can understand your current state and the steps required for certification.